This is Afaf Al-Anazi, master student from King Saud University, Nursing College. And this course, it's problem in teaching. Our lecture, it's evaluation in healthcare education, supervised by Dr. Ulfat Salem. So an evaluation is the final component of education process. Nursing process, decision making process, because this process are cyclic. So evaluation serves as a bridge at the end of one process that guide direction of the next process. Definition of evaluation: it's a gathering, summarizing, interpreting, and using data to determine the extent to which an action was successful. So it's a systematic process by which the worth or value of something, in this case teaching and learning, is judged. Evaluation are not intended to the generalizable, but are conduct to determine effectiveness of a specific intervention in the specific setting with an identify individual or a group. So what is the relationship between evaluation, evidence-based practice, and practice-based evidence? Evidence-based practice has evolved and expanded over decades, and can be defined as the conscious use of current best evidence in making decisions about patient care. So include resulting of systematically conduct evaluation from research. Practice-based evidence is just beginning to be defined and include resulting of systematically conduct evaluation from practice and clinical experience rather than from research. So evidence-based so here the difference between assessment and evaluation. Assessment, that means it's input, and evaluation, it's the output. The difference between assessment and evaluation. Assessment and evaluation are two concepts that are highly interrelated and are often used interchangeably as a term, but they are not synonymous. So it's not the same. Assessment, it's a process to gather, summarize, interpret, and use the data to decide a direction for action. Evaluation, it's a process to gather, summarize, interpret, and use data to determine the extent to which an action was successful. So formative and summative assessment. Okay. It's a set of formal and informal assessment method undertaken by the teacher at the time of learning process is known as formative assessment. It is a part of the instructional process which is undertaken by the teacher with an objective of enhancing the student understanding and competency by modifying teaching and learning method. So formative assessment, it's attempts to provide direct and detailed feedback to both teacher and student regarding the performance and learning of the student. It is a continuous process that observe student need and progress in the learning process. The goal of formative assessment is to monitor student learning, to provide ongoing feedback. That feedback, it can be used by instructors to improve their teaching and by a student to improve their learning. So more specifically, formative assessment help a student to identify their strength and weakness and the target area that need work. Help factually to recognize where students are struggling and address problems immediately. Formative assessment are generally low stakes, which is mean that they have low or no point value. Example of formative assessment include asking a student to draw the concept map in class to represent their understanding of a topic. Also, submit one or two sentences that identifying the main point of the lectures. Also can be a turn in the research proposal for early feedback. So summative assessment refers to the evaluation of the student that focusing on on the result. It's a part of grading process which is giving periodically to the participant, usually at the conclusion of the course, terms or unit. The purpose is to check a knowledge of the student. So sure, it's to check a knowledge of the student. Example, to what extent they have learned the material taught to them. So, summative assessment seeks to evaluate the effectiveness of the course or program, checks the learning process, example, score, grade, or percentage obtained to act as an indicator that show the quality of the curriculum and form a basic for ranking in the school. The goal of the goal of summative assessment is to evaluate student learning at the end of an instructional unit by comparing it against some standard or benchmark. Summative assessment are often it's a high stakes, which is mean that they have a high point value. Example of summative assessment include a midterm exam, final project, paper, senior recital. So information from summative assessment can be used formatively when the student or faculty used it to guide their effort and activities in the subsequent course. So basic difference between formative and summative assessment. We will just check the basic for يعني المينينج natural of each one, what is mean of this assessment and aim, goal, weight. So as we know, as we saw here, formative assessment, it's referred to variety of assessment procedure that is provide the required information to adjust teaching during the learning process. But here the summative assessment is defined as a standard for evaluation learning of a student. So natural here it's diagnostic, formative, summative it's evaluative. So formative it's assessment for learning, summative it's assessment of learning also. Frequently formative it's monthly or quarterly, but summative it's term end. Aim of formative is enhancing learning. The aim of summative assessment it's measuring student competency. So the goal of formative it's monitor student learning. The goal of summative it's evaluate student learning, as we see here. So weight of a grade, formative assessment it's low grade, summative assessment it's high grade. It's it's good different to see in this table. So steps in evaluation: focus on evaluation, designing evaluation, conduct evaluation, analyze and interpret data, reporting and using result of data. So this is a step. It's 1, 2, 3, 4, 5 step. Let's go to the first one. Step 1, it's focus on evaluation. So RSA evaluation model, it places the 5 basic type of evaluation in the relation to one another, based on purpose, related to related question, scope, and resource component of evaluation. These 5 steps lead from the simple to complex. So as we see here, total program at the down, and then the total program down, then it's process, content, outcome, and impact. Process, it's formative evaluation. The purpose here to make adjustment as soon as needed during education process. So scope, it's limited to specific learning experience, frequently concurrent and with learning. So content evaluation, here purpose, it's to determine whether learner have acquired knowledge, skill, just thoughts. Scope here limited to specific learning experience and objective immediately after education completed. Short term, this one. Outcomes, summative evaluation, purpose, it's to determine, as we summative we said it's outcomes. So here purpose, it's to determine effect of teaching. Scope here, it's broader scope, more long term and less frequent than content evaluation. Impact evaluation, the purpose here to determine relative effect of education on institutions or committee. Scope here broad, complex, sophisticated, long term, occur infrequently. Total program evaluation, purpose here to determine extent to which total program meets, exceeds long-term goal. So scope here broad, long-term, strategic, length, therefore conduct infrequently. So the second step, it's design the evaluation. Design the evaluation, it's an important question to be answered in design and evaluation. How rigorous should the evaluation be? All evaluation should be systematic and carefully planned and structured before they are conducted. Evaluation design could be structures from a research perspective. So essential question to be asked when the designing evaluation tool: what type of data you will be collected, complete, people, program, environment, from whom or what will data will be collected, from participant, surrogate, document, and or pre-existing database you will collect your data, and include population or sample. How, when, and where will data be collected? By observations, interview, questionnaire, test, recording review. Secondary analysis may consist with the type of evaluation, consist with the question to be answered. By whom will be data collected? By learner, educator, evaluator, and or trained data collectors. Select to minimize bias. So evaluation barrier, lack of clarity, so resolved by clearly describing 5 evaluation component, specify and operationally defined terms. Lack of ability, resolved by making necessary resource available, solicit support from experts. So here the fear of punishment or loss of self-esteem here resolved by being aware of existence of fear among those being evaluated, focus on data and results without personalizing or blaming anyone, point out achievement, encourage ongoing effort, communicate also. So selecting an evaluation instrument. Identify exiting instrument through literate search, review of similar evaluation conduct in the past. A critique potential instrument for fit with the definitions of factor to be measured. Evidence of reliability and validity, especially with the similar population, appropriateness for those being evaluated, affordability, feasibility also. So step 3 here, conduct an evaluation. When conduct an evaluation, conduct a pilot test first, assess feasibility of conducting the full evaluation as planned, assess reliability, validity of instrument. So include extra time, be prepared for unexpected delays, keep a sense of humor. So step 4 here, data analysis and interpretation. Data analysis and interpretation. The purpose for conducting data analysis is twofold. The first one is to organize data so that they can provide meaningful information, such as through the use of table and graphs, and so second one, to provide answer to evaluation question. Data can be quantitative or qualitative in nature. So step 5, and this is the last step, reporting and using resulting of data. Reporting and using evaluation results. Be audience focused on begin with the one page executive summary. Use format and language clear to the audience also. Present result in person and in writing. Provide a specific recommendation. Stick to the evaluation purpose. Directly answer questions asked. So use data as intended. Maintain consistency between result and interpretation of result. Identify the limitation. Summary of evaluation process. The process of evaluation in the healthcare education is to gather, summarize, interpret, and use data to determine the extent of which an education activity is efficient, effective, and useful to learner, teacher, and sponsors. Each aspect of evaluation process is important, but all of them are meaningless unless the result of evaluation are used to guide future action and planning and carrying out intervention. And thank you for listening.